Hello, everyone. This is Dr. Marzban again from Marzban Family Chiropractic Complete Injury Centers, talking to you from Carrollton, Texas, close to Dallas. And today we are going to be talking about the last part of the fascia, how it is important in treating patients. And here we go. Here is the just how complex the fascia is, and it's a bandage that we talk about. It covers almost everything and every single cell, almost all over the body, and it just do the protection as well as it does a physiological function to interconnect different cells, different organs, and the putting the whole body as a unit. And here is the spider web type of thing that it covers the different layers in the body, the fascia does, and it is just showing that how complex it is at the even in one level. It has multiple levels of the coverage, and there are intersections, and each intersection could be a place that the flow of the energy is going to different directions and spread out in the body. And we have talked about the fascia, how important it is in clinically in clinical setups. And we have heard the fasciitis, and especially plantar fasciitis, that is at the bottom of the foot, and the fascial pain syndrome. And some of the doctors are familiar with this. That there's some of the most there are many pain that patients feel, regardless where the source is. It is going to be affecting the fascia and cause a fascial pain. And there's a fascial adhesions, which if there is a cut or damage to the tissue, the fascia is going to be reforming, and also is trying to fix the area as one of the things that we talk about, the bandage, and it is causing some restrictions in the tissue with the collagen fibers within the fascia, and it causes the adhesion, and that adhesion could be problematic in the long term because it restricts too much of the movements and it blocks the energy flow. And so we have also the fascial slings dysfunction. And again, we talk about different structure in the body is covered with the fascia, and if the fascia is not freely moving and is not doing this function as it should, it causes dysfunction of that structure. And here is an example of the fascia that has a good orientation, and this could be a part that the fascia has a type of scar tissue that has the different directions where the fascia is running and could be causing restrictions. And we talk about the fascia that covers the different layers. In this example, it covers the muscles and around the joints. And we mentioned briefly the plantar fasciitis, that many people they have issue with this, and it could be because of the curvature at the bottom of the foot that causing it, that is not correctly shaped, or it is being affected by some structural dysfunction, and which causes the pain at the bottom of the foot, at the heel of the foot, and so it causes these restrictions at the bottom of the foot, which also be affecting the movements of the bone structures of the foot and ankle that could cause the further issue and pain in the patient. And here it shows that the 2 points, and there's multiple points which we're going to be looking at the following slides, is that there are points like, for example, here at the back of the skull, and that cause that treating those points will help with the headaches. And well, someone will think that how would the headache in a different part of the head would be resolved or be getting help by 2 points right here at the back of the skull. And here is the neck area, and it shows that the fascia covers the different layers of the neck. And here is the point that I'm trying to get how the 2 points right here might be resolving the pain that the patient is feeling in the head, which, the headache. And so we talk about the layers that covers the cells and the structures, and we mentioned about the 3 layers. Usually they are associated with every structure organs. And in this case, it talks about the pia mater, arachnoid, and dura mater, the 3 layers that covers the central nervous system. At these points right here, this fascia that covers the head, it is interconnected with the cervical spine, and especially at the upper level of the cervical spine, this points right here, that is the junction that the meningeal layers, the 3 layers, so the pia mater, arachnoid, and dura mater that cover the central nervous system. At these points right here, they're very closely connected not only with the vertebrae, but also with the fascia that covers the neck. So any tension and dysfunction of the vertebrae or the skull at the upper cervical would definitely could cause the headache, and due to the malfunction of the fascia. But I'm not saying that the fascia is the only point that we need to focus on. What we don't need to ignore it. But the headache could be due to the vasculature, it could be the nervous system, and that is the nerves that crossing and running at the base of the skull, which there are several of those. They all can be involved with this. For example, in this picture, it shows that we have the blood vessels right here, which is the vertebral artery that goes through the holes right here at the upper cervical. Then eventually it goes through the big hole, which is called the foramen magnum. It goes to the head. And this fascia, if they are not functioning correctly and or freely, it could cause some, for example, in this case, the pressure on these blood vessels. And you see that at this junction, the upper cervical, where the meninges as well as the fascia around the neck and attachment to the vertebra could be very important place that a physician should be look into. If somebody, for example, is dealing with the headaches, the vertigo, dizziness, vision issues, balance issues, this is very, very important area that the doctor should be also look into. And this picture shows that, well, we have the fascia that is at the upper cervical, then it can have interconnection with the fascia around the neck and the upper shoulder area. And, well, this is just a verbiage. You can stop the video and read this one, just if you are interested with terminology of what I'm talking about. Interestingly, there are points other than the base of the skull or the face and the head and the ears. In this case, at the wrist, the ankle, and the hand. There are also points that acupuncture can help with the headaches. But how does acupuncture help with the headaches at the farther away from the head? And to point an important aspect to how acupuncture works is that the fascia They are so much interconnected at different areas, and the flow of the energy that we talk about that passes through the layers of the fascia can be the result of the effect of the acupuncture that is done at the farther part from the head that could be affecting the headache for in this case. And here is again the verbiage, and here is the point for the headache that is listed at the back of the wrist and the distal part of the forearm. And again, this complex fascia that is covering the whole body and area structures, again, I cannot emphasize enough that how important it is that how this fascia can cause the brings the health as well as cause the disorders in the body. And again, it is very important to fix the issue if the fascia is the cause, and which it is in most of the cases. In our clinic, what we do, and it should be done in other clinical setups, in order to take care of the health of a patient, we all do the acupuncture, we do the soft tissue work, we do cuppings, and we also teach the patients how to do the stretchings in order to get the fascia more flexibility, and definitely the adjustments that we also talk about how fascia are connected to the vertebrae. And every one of those that are listed right here has its own place to bring health back to the patient and take care of the pain as much as possible. And so any pressure, it could be the acupuncture or the pressure point, and again the cupping, all of those are trying to release the tension that is being enforced in the body one way or another to bring the health back to the patient. And this is an example of the acupuncture. How it helps is that when the acupuncture needle goes into the skin, what we do here is that we turn this needle as it goes in, and the turning of that, it is going to bring the fascia around it, and the fascia is going to stick to it. And when it is being pulled out, the needle is being pulled out, it is going to cause the resetting of this fascia and releasing the tension that is established in the fascia due to other reasons. And so acupuncture is definitely is one of the things that we utilize in order to bring the health back to the patient. Again, this is Dr. Marzban from Marzban Family Chiropractic, Complete Injury Centers. A good health is the best wealth. Please take care of that very well. Talk to you soon. Bye-bye.